At the outset, I thank the ISA Kerala for having given me this opportunity to talk on non-technical skills for anesthesiologists. The non-technical skills are otherwise called as soft skills, and the term first applied to the safety by the European Civil Aviation Regulator. The cognitive, social, and personal resource skills that complement technical skills and contribute to safe and efficient task performance. The soft skills enhance workers' technical skills, and the deficiencies in non-technical skills can increase the chance of error. So the soft skills are good non-technical skills. Example, the vigilance, clear communication, and the team coordination can reduce the likelihood of error and accidents. The anesthesiologists in United States of America were among the first to adapt the aviation crew resource management skills approach for anesthetic training. GABA and colleagues devised an anesthetic crisis resource management. Routinely, we call it as CRM. They devised an anesthetic crisis resource management course as part of their simulation center training program. So the ANS, you may be surprised why this ANT has come. The ANS means anesthesiologists, non-technical skills, otherwise soft skills. They literally means traits that complement hard or technical skills. And the soft skills are a set of skills used by humans when performing the tasks or carrying out procedures while interacting with each other and underlying systems. So the anesthesia practice, routinely we compare it with the aviation industry, both being highly reliability, and both the disciplines demand calmness under intense pressure, compulsive attention to minute detail, and vigilance during long periods of quasi-boredom. So the soft skills I want to stress, they do not in any way relate to medical knowledge. Even if a doctor possesses adequate medical knowledge, if he is not having soft skills, he will fail in practice. So the soft skills taxonomical framework, the first is a communication. Second is a situation awareness. Third is decision making and teamwork, leadership, and management of stress and fatigue. These are all the non-technical skills. Yeah, doctor, mainly the anesthesiologist, has to undergo. I will tell you an example. If you are entering a OT for the first time, then you familiarize yourself by talking to the people, that is communication. Then we will inspect the place and examine the infrastructure, that is for troubleshooting and suitability. Then we will plan and prepare, that is task management. This routinely we are doing, but we are not aware that these are all the soft skills. So we gather information and discuss it with the team. We talk to the patient, we talk to the surgeon, that is the team management. Then we weigh the pros and cons. Then we anticipate problem, that is situation awareness. Then we allot responsibilities to the colleagues and the co-workers, that is leadership. So routinely everyone will be doing without knowing that these are all the soft skills. But any deficiency in this can lead to problems. So the first and foremost is the communication. Why communication is important? It is important for expressing information, behavior, and our feeling of thoughts. So it helps to understand and respond to other feelings. So communication is the most important non-technical skill every doctor has to learn. Because even a small slip costs heavy. Because in a boys' hostel, instead of free internet and Wi-Fi available, they have labeled it as wife available. That has created a lot of publicity actually. We have to be very careful. And even if there is no slip, it may convey a different meaning. For example, this is buy 3, get 1 free is for clothings. But here it conveys a different meaning as 4 girls are standing like this. And if we ask our subordinate to talk on behalf of us, that will also create problem, because a Foley's catheter was written as Foley's catheter. Then a paramedical has written ultrasound abdomen with the pelvis. that is AP and lateral view, just like for X-ray. So we cannot ask the subordinate to communicate. We have to learn communication. So communication is one is a verbal communication where our tone, pitch, quality, and the rate of speech carries more weight than the words. This is a non-technical skill the anesthetist has to learn. And the later convey the emotions and meaning, the tone and pitch quality, that is important. Then the non-verbal communication is also important, like facial expression, eye contact, gestures, body language, proximity, and touch. And most of our communication is non-verbal, which is missing in emails and tweets. That is the reason why we have introduced smileys in the non-verbal communication in the tweets and Facebook. So in communication, the eye contact is a must. We have to maintain appropriate eye contact irrespective of our position. Always maintain eye contact irrespective of the position. And gestures are important. It is not only talking. So talking may be different, gestures may be different. So we have to concentrate on gestures because here talking is different and a gesture is different. We have to be very careful. And I will give a mnemonic people to maintain the body language because that is also important in communication. P stands for posture, I stands for eye contact, and O stands for orientation, and P stands for presentation, how we are delivering the message. And L, look is important. Whenever you are maintaining a communication, your look, appearance, dress code is important. Then expression of emotion, that is the most important. So how to establish a rapport? First, you need a self-confidence. See, even this macaque monkey, it is taking a selfie, it is having a self-confidence. So you should have a self-confidence and we should be enthusiastic to talk to people and we should understand people. And again, I stress, we have to make eye contact and we must be interested in them, or else we must pretend that as if we are interested on them. And again, this is a good diagram. It says the total communication, listening is more important. If a patient is talking to you, please listen patiently. He is a patient, but we have to listen patiently. For it is because it constitutes 45% and speaking is only 30%. So listen. So communication, only 7% is by words and 38% depends upon the accent, tone, voice modulation. And 55% is body language. So body language is also must. We have to concentrate on that. And if you are a good communicator, the good communication brings a balance like a wife, because here the tire is missing, but this wife maintains the balance. So a good communication and a wife brings balance in life. And anesthetist is an Astavadani. When he is doing so much of a work, the non-technical skills should be one among the skills and it should be taught. So how to break a bad news? Here spikes is the mnemonic. Settings is important. Perception is important. Then invitation is important. Knowledge, that knowledge in local language is important to convey a bad news. Then empathy, you should be empathetic. You have to acknowledge the emotions of the relatives. And sequelae, you have to understand. You have to agree on the next step. Same way, if the relatives are angry, we have to find the way of escapism. So sequelae also we should analyze. So the spikes is the mnemonic for breaking a bad news. And the chamber in which you are revealing the bad news, it should also be aesthetic, because anyone can help in communication, living or non-living. So even the non-living furnitures can create a good ambience to break a bad news. So if the mob is angry, good nurse is essential to convey. That is called a nurse approach. It is not the nurse, it is a mnemonic. The nurse approach is name the state of emotion, understand the emotion and respect their emotion, support, then explore. So this nurse approach will help if the attenders are emotional. And if the mob is angry, then it is just like the doctor will become a patient. When multiple doctors are examining the patient, the same thing happens when multiple members are attacking the doctors verbally or physically. So what you sow, we will reap. So if a mob is angry, don't be defensive. Don't take it personally. Listen respectfully, because all psychiatrists say anger as a coping mechanism. Only for 1 hour, 2 hours, they will be shouting at the doctor because they have lost their kith and kin. But at the same time, you set appropriate boundaries for safety. That is all the more important. If need arises, inform police. That is also a non-technical skill. And in the do not resuscitate orders will not be helpful in Indian setup, because the decision made by the relatives may not indicate the wish of the patient. So repeated discussion with the patient is helpful. We have to be very careful on that also. So the anesthetist non-technical skill is the first non-technical skill framework specifically designed for anesthetists. That is the reason it is called as ANS. Every time anesthetists are interested in patient safety more than any other specialty, so they first started this non-technical skills. That is the reason we are talking it in the conference also. So it is applied to a particular department of anesthesia, gradually introducing it to the profession on a national basis. So anesthetists require basic training in non-technical skills. In 1999, the Flynn and Glavin developed a taxonomy of non-technical skills. So a team of anesthetists, with the help of the psychologists and the psychiatrists, they developed the ANS system, anesthetist non-technical skills. So that skill framework has 4 categories: situation awareness, a decision making, task management, and a team working. So communication is a subspecialty in the task management and the team working and the decision making. Here, managing the stress and coping with the fatigue are not directly involved, because it is very difficult to detect the stress unless it is in the extreme stage. So they have omitted it purposely. So in the department of anesthesia, if we have to use the non-technical skills, we have to conduct a meeting, not a morbidity and a mortality meeting. We have to conduct a meeting to analyze the adverse events and analysis of critical incidents, because where the adverse event was avoided was analyzed. That is a non-technical skill. Then only the non-technical skill will be imparted to the next generation. Then another way is tactical decision games. These are all the low fidelity simulation developed by the US Marines. Everything is developed in the US only. So they create a simulation and assess the decision making of the Marines. So it is designed to help the novices progress under the time pressure and stressful emergency situations. The same thing is used in anesthesiology also, but the tool had not formally been evaluated. So ANS can be used in a clinical simulation center through a video replay. Here, instead of CRM, crisis resource management, they have developed crisis avoidance and resource management for anesthetists. So it is karma. It utilizes ANS system as the basis. So the karma is a karma of the anesthesiologists. So we can simulate by analyzing it by a video replay. But the problem is the clinicians are not familiar with its use. Now only it is in the initial stage. That is the reason why we are talking. So we have to give systematic training at 3 different levels. First, at the postgraduate level, we have to tell them the basics so that they can practice and appreciate their importance for patient safety. Second level, the trainer is to be trained. The main point is they should understand the psychological factors influencing human error. Then only the trainers will be helpful to train the trainees. And the third level will be the licensing level. So it is the additional training at a more advanced level. These 3 levels of training we have to impart. But at the same time, we have to give caution. So the behavior rating system looks deceptively simple in the non-technical skills, but a considerable skill is required to make observations and ratings. So we had designed a rating system for professionals who had no training in non-technical skills. So if you make it mandatory, these non-technical skills, the teachers should be adequately trained. Till that time, it will be a problem, because we have produced the cart before the horse. So one aviation expert mentioned, any airline that chooses to introduce crisis resource management or the non-technical skills assessment without first training its captains or simulator instructors is simply ensuring the process will be conducted in a haphazard and unreliable fashion, which is applicable for anesthesiology also. So the carry home message I want to give: the incorporation of non-technical skills in the individuals who are supremely trained can be a tough job. It is not easy as it looks. It is a tough job, and the ANS is once a system developed for teaching, assessing, and evaluating soft skills. It comprises of characteristics and elements of soft skills, and utilizing the system appears, even though it is simple, considerable skill is required to observe and assess the rate of behavior that we have to keep in mind. So without a non-technical skill, the anesthesiologist shoulders will be encroached by public like these monkeys, but a proper anesthesiologist non-technical skills could turn even foes into friends like this. So non-technical skill is all the more important. And I want to inform all of you, the best friends will be always in touch in spite of so many handicaps. And the Kerala ISA has done it in spite of COVID. They are keeping us in touch. So I thank ISA Kerala for the wonderful opportunity. Thank you.